acute sinusitis in adults. Definition: sinusitis is caused by inflammation of the lining of the paranasal sinus. Because the nasal mucosa is simultaneously involved and because sinusitis rarely occurs without concurrent rhinitis, rhinosinusitis is now the preferred term for these conditions.
This patient illustrates the importance of nasal endoscopy in evaluating patients with nasal complaints and sinus complaints. She originally was seen by her primary care physician with nasal congestion, facial pressure, and symptoms of sinusitis. However, when he evaluated the front of her nose, anterior rhinoscopy revealed no evidence of congestion or inflammation. Our evaluation was performed with nasal endoscopy, and this
Rhinosinusitis affects an estimated 35 million people per year in the United States and accounts for close to 16 million office visits per year. Applications in medicines. A 35 years old man present to his primary care physician's office with complaint of nasal stuffiness with yellow nasal drainage, wearing a non-productive cough, sore throat, and muscle ache for 7 days durations. He requests a course of antibiotics. This patient present with the common complaint of stuffy nose and facial discomfort in addition to several other familiar upper respiratory symptoms. Nasal symptoms account for one of the most frequent complaints encountered in primary care practice and encompass a broad differential diagnosis. At the outset of the patient's illness, several entities could account for his symptoms. Common causes include seasonal allergic rhinitis, perennial allergic rhinitis, vasomotor rhinitis, acute viral URI, and sinusitis. If the patient reports a history of excessive use and nose drop, rhinitis medicamentosa also needs to be considered. Pros.
Kills sinus infection in 20 seconds with this simple method of the house. Sinusitis is inflammation of the sinuses of the skull located on the forehead on both sides of the nose, which is due to an infection of the nostrils or dental alveoli, usually causes nasal obstruction and headache. Cleaning the sinuses helps prevent and fight infections.
Acute sinusitis is clinical diagnosis, good prognosis, and most cases, home remedies are all that's needed to treat acute sinusitis. Cons: infection is a common complication of sinusitis, decreased sense of smell, mucosal infection, and surrounding structures. Diagnosis: acute sinusitis is a clinical diagnosis. However, the evaluation might include the following laboratory tests with nasal cytology, nasal sinus biopsy, tests for immunodeficiency, cystic fibrosis, or ciliary dysfunctions. Imagine plain radiograph, opacification of the sinus and air fluid level best seen in the maxillary sinus. CT, better anatomical delineation and assessment of inflammation, extension, cause, and complications. MRI, T111 can differentiate between the mucosal thickening that is intense to soft tissues and fluid that is intense.
Hello there. The topic is plain radiography of paranasal sinuses. Here we will discuss some plain radiographs that are usually used for visualizing paranasal sinuses. The first plain radiograph that is most commonly used is Waters view, also known as occipital view or nose chin position, because it is taken with the nose and the chin of the patient touching the film, as can be seen in the picture, and X-ray beam is projected from behind. It can be taken with open mouth to visualize the sphenoid sinus. It is best for visualizing maxillary sinuses. Here is an example of Waters view showing nasal septum, orbits, these are orbits, and upper jaw, lower jaw. So where are the sinuses? This is maxillary sinus, this is left maxillary sinus, this is right maxillary sinus.
Treatment of acute sinusitis consists of the providing adequate drainage of the involved sinus and appropriate system treatment of the likely bacterial pathogens. Drainage can be achieved surgically with sinus puncture and irrigation techniques. Is applied in Ecuador. Approximately that 5% of the all upper respiratory tract infections are complicated by sinusitis, which is most common in adults. Sinusitis is one of the 10 most common diagnoses in primary care. 1 in 10 people visit their doctor with sinusitis each year. Conclusion: initial management of acute bacterial sinusitis should be based on shared decision-making with the patient, which can be facilitated via decision grid if watchful waiting is chosen. The patients in the vicinity may be given a safe net or wait and see prescription for antibiotic to use if the illness worsens at any time or the symptoms do not decrease within 7 days. She should be advised to contact her physicians if the symptoms have not decreased by that time, or if she begins to have worsening symptoms at any point.